Professional Development Presentation by Christiana Coleman. Kairos University. Trauma, Grief and Loss Specialization, Spring 2026. My topic is Understanding Trauma Responses and Disenfranchised Complicated Grief in Individuals Experiencing Perinatal Loss, Advanced Counseling Theories, and Therapeutic Intervention Approaches. Learning Objectives and Purpose of Presentation. 1. To define perinatal loss, invisible grief, complicated grief, and disenfranchised grief. 2. Identify trauma responses associated with perinatal loss. 3. Recognize emotional, relational, cognitive, spiritual, and physical impacts of disenfranchised grief. 4. Understand how invalidation and social silence complicate healing. 5. Apply advanced counseling theories and interventions in clinical practice. 6. Integrate trauma-informed, culturally responsive, and ethically grounded care. This presentation purposed to provide therapists, clergy, health professionals, and other helping professionals with advanced knowledge and evidence-informed counseling approaches and therapeutic interventions for supporting individuals and families experiencing trauma responses, complicated grief, and disenfranchised grief following perinatal loss. Perinatal loss. Perinatal loss is often traumatic because it involves sudden emotional shock, medical trauma, physical pain, loss of attachment, shattered expectations, isolation, and silence. Perinatal loss causes a profound, isolating pain called invisible pain because the loss is not publicly witnessed, leaving parents to mourn without traditional bereavement rituals or adequate social validation. Navigating this complex, often disenfranchised grief involves understanding its unique weight and finding appropriate spaces for validation. Perinatal loss may include miscarriage, stillbirth, ectopic pregnancy, neonatal death, infant death shortly after birth, failed fertility treatment, and termination of pregnancy due to medical complications. These types of losses feel invisible because they lack tangible memories. No photographs, no tangible objects or shared stories to anchor their memory. Parents grieve an imaginary future, milestones, and bond formed long before birth. Disenfranchised grief. Disenfranchised grief, developed by Kenneth Docker, is grief not openly acknowledged, not socially validated, and not publicly supported. The grief is disenfranchised when others minimizes the loss because they did not meet the baby or they expected parents to move on quickly. Friends, family members, church members offer platitudes like, "You can have another baby. Everything happens for a reason. God gives, God takes. In everything, give glory to God. At least it happens early." These platitudes invalidate the severity of parents' emotional pain. Cultural silence around perinatal loss gender expectations, and limited mourning rituals also minimize the severity of parents' emotional pain. On the other hand, mothers experience physical dissonance because the body continues to feel pregnant or nursing, causing a distressing disconnect between physical symptoms and absence of the baby, while fathers and partners suppress their own grief to act as a source of strength, leading to feelings of guilt, hidden sorrow, and isolation. When grief of perinatal loss is invalidated, it can spiral into complicated grief, deep feelings of failure, anxiety, and prolonged depression. Understanding trauma responses in individuals experiencing disenfranchised grief of perinatal loss. Responses can be emotional, physical, cognitive, relational, and spiritual. Emotionally, these individuals' brain and body automatically reacts. Emotional responses to disenfranchisement of perinatal loss may include anger, emotional numbness, hopelessness, shame, anxiety, sadness, depression, and shock. Physically, these clients may experience sleep disturbance, fatigue, somatic distress, hyperarousal, and loss of appetite. Cognitively, responses may include self-blame, catastrophic and intrusive thoughts, and rumination. It might also be difficult to concentrate. Because individuals grieve differently, differences in grieving styles might affect couples' relationship and relationship with all stakeholders like friends, family, neighbors, co-workers, and so on, perceived to minimize the perinatal loss and disenfranchise the parents' grief. Parents' relational response might also include emotional withdrawal, communication breakdown, and intimacy concerns. Spiritually, parents affected might be angry with God and lose faith. Most times, existential questions run through their head and they become spiritually confused. More importantly, disenfranchisement may worsen trauma as parents feel isolated, suppress grief, and refuse to seek and/or accept help. Understanding complicated grief in individuals experiencing disenfranchised grief of perinatal loss. Traumatic grief is a combination of trauma symptoms and bereavement symptoms. It includes pain reactions, hypervigilance in future pregnancies, flashback of labor or miscarriage. Disenfranchisement of this traumatic grief and its symptoms make grief complicated, more intense, and prolonged. Other risk factors for complicated grief include lack of support, history of infertility, stillbirth or miscarriages, relationship conflict, and cultural stigma. Symptoms of complicated grief may include persistent yearning and hopelessness, chronic guilt, identity disruption, avoidance behavior, and difficulty engaging with life. Advanced counseling theories and therapeutic intervention. I will be using attachment theory for this presentation. Attachment theory is developed by John Bowlby and expanded by Mary Ainsworth. This theory posits that humans are born with an innate drive to form strong emotional bonds with primary caregivers. Attachment begins before birth. When severe psychological trauma occurs during pregnancy, at birth, or during developmental years as in perinatal loss, foundation of secured attachment is disrupted and or destroyed. Perinatal loss therefore disrupts emotional bonding, future expectations, and marital or paternal identity. Therapeutic interventions based on attachment theory. Therapeutic interventions based on attachment theory should validate parental attachment, normalize grief responses, and address attachment trauma. To do this, attachment-focused EMDR can be used to focus on relational deficits and gridlock trauma bonds. Emotionally focused therapy can also be used to help individual clients or couples identify insecure attachment loops and share underlying core fears. Therapists will use internal family systems to assist clients to explore internal paths to heal underlying vulnerability. I will also recommend using somatic experiencing to guide and assist clients to release biological survival energies like fight, flight, freeze, trapped in the body without requiring a continuous retelling of the cognitive narrative. Note that continuous retelling of the cognitive narrative might re-traumatize patients or clients. Positive and negative impact of disenfranchisement of perinatal loss. Perinatal loss and disenfranchisement can profoundly shape how individuals experience trauma, grief, and loss. Impact is often multidimensional: emotional, cognitive, relational, spiritual, cultural, and physical, as had been discussed under responses. While these effects are frequently painful and destabilizing to some individuals, to others, they may also experience growth, resilience, meaning, reconstructions, and or deeper relational connection over time. Conclusion and closing reflection. Perinatal loss is often traumatic and socially minimized. Disenfranchised grief can intensify emotional isolation and prolonged healing. Validation is therapeutic. Advanced counseling intervention must address emotional, cognitive, relational, cultural, and spiritual dimensions of grief. Healing involves meaning-making, compassionate presence, and restoration of connection. Conclusively, when grief is acknowledged, validated, and compassionately witnessed, healing becomes possible, even in prolonged complicated grief of perinatal loss. Discussion questions. Your reflection on this presentation is welcome. Referrals. Patients or clients might be referred to Postpartum Support International, Share Pregnancy and Infant Loss Support, American Counseling Association, Grieve Share. Thank you for listening.